Hello everyone, welcome back to the channel. In my previous videos, I completed all the lower limb muscles. At the end of the last video, I mentioned that I would create AI based visual animations and images for each muscle to make learning easier. I have now created them and I hope they will be helpful for you. In each video, I'll explain the muscles, origin, insertion, now supply action, and especially applied anatomy and special test, and most importantly, the mnemonic to help you to remember. So today's muscle is the iliacus muscles. Okay, although I have already explained in the muscle in my previous videos, this time we will study it separately so that you can understand and remember it better. Okay, so let's begin. So iliacus muscle is one of the muscle of anterior hip muscles. It come under that region. So you can see the origin. So it get originate from the iliac fossa. You can see in the picture I am showing there iliac fossa and get inserted to the lesser trochanter of the femur. Okay, lesser trochanter of the femur. It get originate from the iliac fossa and inserted to the lesser trochanter of the femur. So actually, this muscle has more than one region or origin, but for exam revision and easy remembering, we will focus on the most important one, that is iliac fossa. So it get originate from the iliac fossa. So insertion is only one point, that is lesser trochanter of the femur. So iliacus also originate from the few other structures, but if you don't have to remember all of them right now. If you remember the iliac fossa as the main origin and the lesser trochanter of the femur as the insertion, that's more than enough to understand the muscle. Okay. So now supply, of course, from the femoral nerve because it related to femur bone, right? And femoral nerve, that is L2 to L3, lumbar of plexus. So actions we will see in the next part. Action of iliacus muscle, you can see in the picture, that is flexes the hip, that is brings the thigh towards the chest and helps in the internal or the lateral rotation of the thigh and stabilization of the hip joint and helps bend the trunk forward when the leg is flexed. Okay, so you can see in the images I created in very good manner. So next, everyday activities, you can see the walking. It helps for walking, running, climbing stairs, getting up from the chairs, or kicking a ball, or any other like movement action. So it is the strongest flexor of the hip. Okay, so remember, strongest hip flexors. Okay, yeah. Next part is applied anatomy, that is clinical importance. So first one is tight iliacus muscle. It causes reduced hip extension and can lead to low back pain or may cause in anterior pelvic tilt, that is pelvic tilt in forward direction. So second one is weak iliacus muscle. If tight iliacus muscle will be there, then weak should be also there. So difficulty lifting the leg, a trouble climbing stairs, a weak hip flexion, those things. Then a third one is iliopsoas strain. A psoas major muscle also included in this applied a clinical aspect, that is common in commonly seen in runners, football players, and dancers. So pain in the front of the hip or the groin region, we say, no. So almost it should common in the runners, football players, or the dancers. Okay, the fourth applied anatomy is a femoral nerve injury. So it may cause weak hip flexion because the iliopsoas is supplied, iliacus loses its nerve supply, right? It is supplied by the femoral nerve, so it loses its nerve supply. So this may lead to weak hip flexion. So these are the some applied anatomy aspect. So next we see the special test. Okay, a special test for iliacus muscle is the Thomas test. So it's most important special test. It's also used for like iliacus and iliopsoas muscles. Okay, so uh, So how do we perform this test is, first ask the patient to lie comfortably on their back on the examination table. So next ask the patient to bring one knee towards the chest and hold it with both hands. So this helps flatten the lower back against the table. Now observe the other leg. Okay, if other leg stays flat on the table, the test is negative, which means the iliacus muscle is normal. So however, if the thigh lifts up from the table, the test is positive, means indicating tightness of the iliacus or the iliacus muscle. So uh, this is one of the special test used for the iliacus muscle. So second test is manual muscle testing. So this is we are testing it by checking the strength of the hip flexion. So ask the patient to sit at the edge of the examination table with the hips and the knees bent to 90 degrees. So stabilize the patient pelvis with one hand and prevent unwanted movement. So stabilize them. So now ask the patient, lift your thigh up. Don't let me push it down. Okay, so ask them to lift their thigh up. So place your other hand on the front of the lower thigh, just above the knee, and apply moderate downward resistance while the patient tries to keep the thigh lifted. So grade 4 if comes, if the patient completes the full range of motion and can hold the position against the moderate resistance, the muscle strength is grade 4, that is good. So yeah. So next part is summary part, that is mnemonic part, that is easy memory. A trick is I flip. Okay, I stands for iliacus, the muscle we are studying right now, and F stands for the femoral nerve, which is the nerve supply for the iliacus, and L, that is lesser trochanter. Insertion of the iliacus is the lesser trochanter of the femur. Well, I stands for iliac fossa, that is the virgin point of the iliacus muscle. Then P stands for the powerful hip flexors, that is iliac is a powerful muscles that flexes the hip, as we all know. So this is the easy trick to remember. I flip, the mnemonic is I flip. Okay, so we completed iliacus muscles, virgin point, insertion point, now supply, action, a clinical part and special test, and as well as the mnemonic part. So if you guys have any doubt, please comment in the comment section, and if you like this video, please give one like, and if you want more uh, this type of video, subscribe my channel. I'll upload each muscles in the same pattern. So thank you for watching this video. See you in the next video.